Welcome to our today's topic, confirmation bias in clinical practice. We will explore what confirmation bias is, how it affects clinical decision-making, and strategies to mitigate its impact. Confirmation bias is a cognitive bias that involves favoring information that confirms our existing beliefs or hypotheses. This bias can significantly affect clinical practice, leading to diagnostic errors and poor patient outcomes. In simpler terms, it's when we look for evidence that supports what we already think and ignore information that might contradict our beliefs. This can be particularly dangerous in clinical settings, where a misdiagnosis can lead to incorrect treatment and harm to patients.
Some might argue that confirmation bias is a natural tendency and unavoidable. While it's true that we all have this bias to some extent, acknowledging its presence is the first step toward mitigating its negative effects in clinical practice. We propose three main strategies to mitigate confirmation bias in clinical practice. 1. Encouraging continuous learning and reflective practice. 2. Fostering awareness among medical practitioners. 3. Adopting more scientific and objective decision-making approaches. Continuous learning and reflective practice are crucial. By regularly evaluating and reflecting on our decision-making processes, we become more aware of our biases. This practice encourages critical thinking and questioning of established diagnoses, which can reduce the impact of confirmation bias. Raising awareness about confirmation bias among medical practitioners is another essential strategy. Promoting more objective and evidence-based decision-making empowers practitioners to make more impartial clinical decisions, ultimately improving patient care. Finally, adopting more scientific and objective decision-making approaches ensures that clinical judgments are grounded in empirical data rather than preconceived notions. This practice leads to more accurate diagnoses and better patient outcomes. In conclusion, while confirmation bias is a natural cognitive tendency, its impact on clinical practice can be detrimental. By encouraging continuous learning, fostering awareness, and adopting scientific approaches, we can mitigate its effects and enhance clinical decision-making.